To get started in 1 minute. Before we get started, we're going to have our Spanish interpreters provide some instructions.
Excellent. Thank you. Welcome, everybody. We will be having simultaneous interpretation today, which means the Spanish interpreters will be in a separate channel. In order for you to receive the interpretation or listen in English, you must choose a channel. Everybody must choose a channel, English or Spanish. The globe, once the interpretation is turned on, you will see the globe at the bottom of the screen. That's where you go to choose your channel. If you do not see a globe, it means you're maybe on a tablet or your phone and you will see the three dots that say more, and then you will be able to choose interpretation there. Buenas noches, buenas tardes. Vamos a tener interpretación simultáneamente. Eso significa que ustedes van a poder escuchar la interpretación en vivo. Van a ver un globo ya que se prenda la interpretación abajo de su pantalla. Si no ve un globo, va a haber 3 puntos que dicen más o more. Quizá usted está en una tablet o un teléfono y ahí es donde va a poder elegir su canal. Importante que todos elijan un canal. Important that everybody chooses a channel. Y ahora vamos a aprender la interpretación. We will now be turning on interpretation.
Great. Welcome, everyone. Good evening. My name is Erica Phillips, and I am the Executive Director of the National Association for Family Childcare. So welcome. Thank you for being here with us today. Before we jump into our agenda, I want to just first quickly check that the Spanish interpretation has been turned on.
It has not.
Okay, we're going to turn that on now. All right, well, while we get that started, I want to just say a few things today. And I want to start by naming the moment that we're in. There is a lot shifting right now at the federal level. And for many family child care educators, I know that that uncertainty feels personal. These policies aren't abstract. They shape our livelihoods, our childcare businesses, and the ability to keep doors open for families who depend on family childcare. So as we talk through the high-level regulatory changes today, I want to be clear that we're holding the human impact in children at the center of today's conversation.
Al centro de las conversaciones de hoy.
So I'm really excited to introduce Daphne Alsayo, apologies, Daphne, who recently joined NAFCC as our new policy strategist. Daphne is stepping into this work at a critical time, and we're so grateful to have her helping us track these federal shifts to translate what they mean for family childcare and think strategically about what comes next. You'll be hearing more from her as we continue to engage in this moment together. So thank you all for the guest speakers who have deep policy expertise and an understanding of how federal decisions land in real communities. Our hope is that you leave here tonight feeling better informed and also reminded that you are not alone. With that, I will turn it over to Daphne.
Thank you, Erica. Before I get started, can we have the interpreters give instructions in Spanish one more time for selecting interpretation?
Ok. Una vez más, las instrucciones para interpretación, ya que se encienda la interpretación, no ha sido encendida, por eso no ven un globo. Van a ustedes ver el globo abajo de su pantalla. Ya que vean el globo, van a dar clic en el globo y van a elegir español. Yo no he sido asignada a la interpretación, quizá por eso no lo veo. Entonces, pueden ver el globo abajo de su pantalla y si no ven el globo van a ver tres puntos que dicen más. Ahí va a poder seleccionar español. Quizás si está en su tablet o su teléfono va a ver los tres puntos en vez del globo. Pero si ya ha sido encendido van a ver un globo.
Wonderful. Thank you. And thanks again, Erica. And thank you all for making the time to join us tonight. As Erica said, we know there's so much going on right now, and we do not take it lightly that you're spending your time with us. So thank you for being here and for being a part of the conversation. In just the last 2 weeks, we've seen actions from the Department of Health and Human Services that directly affect how childcare operates in this country, especially for family childcare educators who rely on predictable and stable funding. So we're going to start with what we know. So we know that the Department of Health and Human Services has put a freeze on over $10 billion in federal funds for 5 states. And those funds include Child Care Development Fund, Temporary Assistance for Needy Families, or TANF, and Social Services Block Grant programs. We also know that there is also a Notice of Proposed Rulemaking that is open right now. On January 5th, the Health and Human Services Department issued a Notice of Proposed Rulemaking for the Child Care Development Fund. And we're going to talk a little bit more about what all of those provisions that are in the new rule do, but basically it rolls back a 2024 rule which focused on moving states toward enrollment-based payments, prospective paying for subsidy, a 7% cap for families for copays, and also looked at vouchers or looked at contracts and grants for specific populations. We also know that since last year, there have been some defend the spend requirements that have been in place. And now I've got some music. Wait until the music stops. There we go. Need to bring a little fun into the conversation, right? Find joy where you can. So we know that there are some defend the spend requirements that have been in place since last year that are requiring additional documentation for some states before federal funds can be released. We also know that there's litigation that is happening, and so all of that just together creates for a lot that is going on in our policy system for childcare right now. So with all that we do know, there's a lot that we don't know. And we're hoping to get a little better understanding of what we don't know tonight from our guest speakers. So we don't know the regulatory timeline. We know that there's a 30-day public comment period that's open right now, but aside from that, we don't really know how long it's going to take to get clear answers or guidance. We also don't know how far the expansion of the potential funding freeze could be, as well as the impact of defend the spend. We don't know how long it's going to last. We don't know how states are going to respond. We've already seen a lot of variability across states and states responding differently. And then we don't know the long-term impact. We are continuing to try to assess how all of these ripple effects will impact childcare across the country. And our guest speakers are going to share a little bit more and go into a lot more detail about what all of these mean. But taken together, these changes are not small. They affect family economics, workforce economics, and supply. And as you all know better than anyone, in childcare, cash flow is policy. So when payments stop, programs close. And when programs close, families lose access, sometimes even overnight. So I'm going to turn it over to two amazing policy experts. who are going to really get into the details with what all of this means. So please join me in welcoming Ruth Friedman, Senior Fellow at the Century Foundation and former Director of the Office of Child Care, and Kira Weber, Senior State Policy Analyst at the National Women's Law Center. Thank you both so much for joining us, and I'm going to turn it to you, Ruth. Thank you.
Thanks, Daphne. And thank you, Erica, for having me. Thank you all for joining. I know it has already been a long day for all of you. And I appreciate the time you're taking tonight, as well as everything you do on behalf of kids and families in your communities every day. I know how hard you guys are working, and I know for many of you, 2025 was a difficult year after many difficult years. Appreciate the opportunity to come speak with you tonight. As Daphne mentioned, I ran the Federal Office of Child Care during the Biden administration, and have been continuing to focus heavily on child care policy over this past year, since I left my position with the Biden administration. Unfortunately, I'm here today to talk broadly about the situation we are in, which is that the Trump administration has launched a politically motivated attack on childcare, really just the past 3 weeks, broadly calling out fraud as a major problem in the federal child care program, and posing a real threat to providers and millions of families. What I'm going to do is I'm going to talk about what has actually gone on between the administration and states, and discuss the impacts we are already seeing and the very real threats to childcare and the families that rely on it as a result of this situation. I do want to be clear that this is a manufactured crisis. The administration hasn't presented any evidence of fraud. They haven't followed any of the specific procedures they are supposed to follow, and they've acted in ways that are incredibly disproportionate, even if there was some fraud. They have been using it very specifically to target political opponents. They have used it specifically to justify sending thousands more ICE officers to Minnesota. They have used it to seek out Social Security information and other identifying information on people. And unfortunately, they're using it to try to diminish trust in government and the important services it provides. We are already seeing the impacts of this attack on childcare providers and families. And broadly, as a field, we are facing, I think, the real dual threat of potentially losing the progress we've made over the past decade, and a real risk to the very real momentum we've seen for transformative reform and investment in how the country approaches childcare. I do want to stress that organizations like NAFCC are on top of this. They are monitoring it closely. I am working with a slew of organizations like the one that Kira works for. There are lots of people organizing all over this country on behalf of childcare providers and families to counter this attack. You are not in this alone. We are committed to having your back. But the threat is real, and we have quite a lot of concerns. So I'm going to start by describing what is going on with the 5-state freeze. This sort of all kicked off on December 26th when a social media influencer put out a YouTube video alleging fraud in the Minnesota child care program, and specifically at Somali-run child care programs that he visited. That YouTube video has now been seen hundreds of millions of times, unfortunately. This has been political from the start. He was actually given the list of child care centers to investigate by the Republican Speaker of the House in Minnesota, who intends to run for governor and was likely to be Governor Tim Walz's opponent. A few days after that video went viral, HHS, the Department of Health and Human Services, who runs the federal child care program, they announced via a tweet on X and a video that they were freezing all of Minnesota's federal child care funds. And they made allegations of widespread fraud, particularly calling out, again, the Somali community as being perpetrators of this fraud. They said they were basing this freeze on that YouTube video and a dissatisfying call with the Minnesota state administrator. They provided no evidence of the fraud, and they required Minnesota to give them huge amounts of data about families and providers participating in the program, including Social Security numbers and other identifying information before HHS would consider releasing child care funds. And then about a week later, the Trump administration told California, Colorado, Illinois, Minnesota, and New York that they were freezing all child care, TANF, and SSBG, the Social Security Block Grant Fund. So TANF is the Welfare Cash Assistance Program. Social Security Block Grant, if you're not familiar with it, it's a very flexible pot of money that states can use to fund a variety of programs for families with low income. So they said they were freezing $10 billion across these 5 states. That includes $2.4 billion in childcare. They actually told the New York Post newspaper a full 24 hours that they were doing this before they told the 5 governors anything. Freezing that childcare money would mean ending assistance, childcare assistance for more than 300,000 children in those states. It would also mean that the childcare programs in those states wouldn't be paid for services they had already provided. As you all know, that would mean putting those programs at risk of closing, impacting probably another 200,000 children who don't receive assistance but rely on the programs who serve children who do. The administration, the Trump administration, they said the reason for freezing these funds were they were, quote, concerned by the potential for extensive and systemic fraud in the state's child care program. And they had reason to believe the state was providing child care funds to, quote, illegal aliens. They again told the 5 states they wouldn't be able to access their funds until they turned over huge amounts of data on program participants, including lots of identifying information. The data they asked for was not information states have previously been required to collect, so nothing they had on hand, and something extremely burdensome and time consuming. And again, the administration provided no evidence of fraud in these claims. So again, what the Trump administration was doing was making a claim of creating a child care fraud story, but with no evidence of fraud. The story is really about the administration intentionally undermining public confidence in key social service programs and trying to push an anti-immigrant narrative while trying to collect more detailed information on legal immigrants along the way. On January 8th, the attorneys general in those 5 states sued the Trump administration. The very next day, a court blocked the administration from freezing those funds, and that's where things stand. So those 5 states do have access to those funds for the time being, and that case will actually be back in court tomorrow. So the case has not been decided, but at the moment, the states have access to those funds. You can go to the next slide. So on December 30th, that first tweet and video that HHS put out when they first said that they were freezing Minnesota's funds, they also announced that they would be instigating a new, what they call a defend the spend process for all states, territories, and tribes that receive the federal child care program. What this has meant is that now states usually when they are ready to draw down funds to like pay providers or to do their quality activities, that is really just a bureaucratic, when they're ready to pull that money down from the federal government, they've already been approved for that. So they just go into the system. They say, we're ready to spend the money. They pull it down. It takes a day or two and it shows up in their account and it's theirs to spend. What the Trump administration is now requiring is that they have to provide a justification and they are having to provide new evidence and data around it. What you have on that screen there in that white square is what the states, that's the official notice they get when they try to draw down those funds. But when states try to give a justification, what is happening is HHS is telling them that's not enough information and they have to give them more data. And that is creating delays. So instead of this just being a very quick 1 to 2 days, states can just draw money when they're ready for it. They're having to provide data that they haven't previously had to provide to HHS. They don't know, they haven't been given good guidance or clear guidance on what they're going to have to provide to HHS each time. It's taking longer for HHS to review it and release the funds, so it's creating delays. Some of you may be in states where you've actually gotten a notice from your state warning you that there may be delays. There was a news report in Missouri of one program temporarily closing because of delayed funds. So it's created a lot of confusion and has certainly created delays in states actually accessing their funds. And it's still sort of a wait and see game as to what this is actually going to mean. But I will say the process is very concerning because there is no transparency as to what information is actually being required by HHS to each state, whether or not HHS is treating all states equally. So we're very concerned that they may treat one state with a lighter touch than another state. This administration, unfortunately, has a history of treating people that they see as political enemies with a much harsher hand. And because there is not a lot of transparency on this, it is an easy opportunity for them to require a much different threshold for some states than other states. It would be easy for them to take longer to review some states and other states, and it's not going to be very easy for us to tell this unless states are comparing notes with each other. So it's something that we are doing our best to keep a very close eye on because there is an opportunity. There's quite a lot of opportunity here, I think, for bad actors. HHS also launched a new plea for the public to report fraud in childcare on their website, which really links to each state's website. So I've been talking to some state administrators, and they say they have been getting more reports. I know states have been dealing with a lot of nuisance calls. And, we are certainly very worried about what that is going to mean for providers as well. You can go to the next slide. And then the next piece of this has to do with the new 2026 CCDF rule. As you all may remember, in 2024, the Biden administration, it was my office, finalized new regulations for the federal child care program. Our goal was to pay providers who participated in CCDF more fairly, to help stabilize the sector, increase parents' options in child care arrangements, build supply a bit, and lower parents' costs. It was really, really important to us that providers be treated more fairly. We thought that was really important, long overdue. We were really pleased with this reform for the program. We gave states 2 years to implement it because We knew it was going to take them a bit of time. We wanted them to be thoughtful in how they were doing it. We knew they couldn't turn on a dime to do it. But we were really excited about where this was going to take the child care field. Unfortunately, the Trump political leadership told state child care administrators last summer that they were going to repeal the 2024 child care rule. And they told states they could stop implementing it if they wanted to. The reasons they gave were that they wanted states to have more flexibility. They didn't want to have states to take on that cost. Of course, states taking on the cost means that providers have to take on the cost instead. And they said the fact that states hadn't implemented it yet meant that it was too hard. Really, this was part of a broader anti-Biden agenda and part of a broader deregulation agenda. We were really disappointed because we knew it would slow progress in some states and halt it in others. And we knew how important, in particular, those payment practice reforms were going to be for providers. But it was a little soul crushing. But we knew reforms would continue, just perhaps a bit more slowly than we wanted. But unfortunately, this all got a lot worse this month because they decided to tie this repeal of the 2024 rule to this whole fraud narrative. So even though they told state administrators last summer they were going to repeal the 2024 rule, it takes some time for the agency to write that new rule. So the official written proposal to repeal it, the NPRM is what it's called, is the acronym for it. It was published the first week in January. And if you actually are a policy nerd and you read it, it doesn't actually mention fraud. And it mentions all the reasons that they said over the summer, the cost to states, state flexibility, it's too hard. But they don't talk about fraud. But they've started in press releases and they sent a blast email to Congress tying it to this fraud narrative. They clearly worked with the media, and they are tying it to what they're calling a Biden loophole. And they are claiming that enrollment-based payment and prospective payment practices are basically fraudulent. And unfortunately, now not just the Trump administration, but congressional Republicans have taken up this call that these really important payment practices that have never been partisan before. They've long been bipartisan. And in fact, when we passed the rule, almost half the states already did enrollment-based payment, and almost half of them were red states. This was not a blue state, red state thing. It hasn't been a partisan issue, and they have chosen to make it so. And we are really, really worried that not only is repealing the rule now going to lead to slowing the progress that we are seeing, but there is going to be pressure in some states to undo these important practices where they are already in place. And then we can go to my very last slide. And I just want to talk briefly about some of the impacts that we are already tracking from all of these things that I've gone over today. And some of you may have already experienced them yourselves or heard about them from your colleagues. We have been collecting stories and hearing about stories about harassment of providers by the public and by ICE. There are stories of other people sort of wanting to replicate that viral YouTuber knocking on the doors of providers and trying to make videos. A state administrator told a colleague of mine that someone was calling up posing as the state and asking for social security numbers. So providers are getting harassed. There's certainly confusion and concerns for providers about getting paid and what any of this defend the spend or the freezes in the 5 states means. a really concerning demonization of the childcare sector by public officials. This anti-fraud narrative is just so upsetting and just so misplaced. Um, uh, we are tracking a couple already bills being introduced in state legislatures. There's one in Ohio, for example, that would require cameras to be placed in any childcare program that took public funding with live stream to the state agency so they could be sure to track attendance. There's just a lot of confusion in the field, and state agencies are also dealing with these delays and added burdens themselves, and what that means for getting their dollars out the door, getting providers paid. Um, uh, I do, I do want to again say I do think the threats are significant. I think it's important that we are all aware of them. I have never seen anything like this in my 25 years of working in early childhood policy. But I do want to assure you that there are a lot of people fighting hard for you who appreciate how hard you work every single day and all you do for your community and for families and are determined to go to the mat for you on that. And with that, I will stop there. I know we have more presentations and time for Q&A later. Thank you.
Thanks, Bruce, for that sobering information. And thank you, Erica and NAFC team for holding this webinar tonight. So important to share all of this information and learn what we can all do from it. So I am happy to be here, even though I wish it was under better circumstances. My name's Kara Weber. I'm a senior state policy analyst at the National Women's Law Center in DC. And as Daphne noted earlier, there are for provisions in the NPRM that Ruth was talking about that we're watching closely because if they move forward with the repeal, we'll lose progress that we've made, and it will negatively affect childcare providers and families. So I'm just going to explain a little bit more about what is in these provisions and why we disagree. And so the first one is that we're keeping an eye on is the proposed repeal of the 7% cap on family co-payments. And this will hit families with low incomes and families who have multiple children receiving subsidy the hardest. Research shows families with low income spend on average 35% of their income on childcare costs, and families with higher income pay an average of 7%. So by eliminating affordability guidelines, like the 7% copay cap for families receiving the CCDF subsidies, the door is open for increased copayments, and it also creates a barrier to childcare by forcing families to base childcare decisions on the cost instead of the option that best meets their needs. And then the next part we're watching is the repeal of the requirement to use some grants or contracts for direct services. As we know, there's a serious shortage of childcare across the country, particularly for families living in low income or rural areas, families with infants and toddlers, children with disabilities, and families in need of non-traditional hour care. So especially for these families, grants and contracts can be an effective tool and strategy for addressing this shortage. um, of these and other types of care by helping to increase the supply, stability, and quality of childcare by reducing provider uncertainty. And additionally, like grants and contracts can help improve parent choice by expanding the range of options in communities where there aren't many available, like in low income neighborhoods and rural communities. And they also enhance the availability of resources to a range of different childcare providers who would not otherwise be able to provide care where there are shortages. And then the third and fourth provisions that we're keeping an eye on have to do with payment practices. And I think this is probably a big one, big two, I guess, for all of you to really understand that the repeal to pay childcare providers prospectively. And I'm sure you're all aware of what this means. But it's beneficial to providers and families. It helps to stabilize childcare operations and increases family choice by supporting a broad range of childcare options. And it also aligns the subsidy payment practices with those by private pay providers or families. And when state reimbursements are delayed, this can cause financial strain on providers and it can threaten program stability and even cause some to close. And then the last is the requirement to pay childcare providers based on child enrollment rather than attendance. And I think Ruth just said this, we've already seen a lot of states move to this. It doesn't, so we're hoping, that states will continue, but we don't know if it is repealed. And, obviously this is helpful in for providers. Enrollment-based payment practices allow for stability and planning and budgeting for childcare businesses, and to prevent programs from losing funding due to occasional absences, which can occur for, many reasons. The child is sick or family goes on vacation. Childcare businesses already operate on thin profit margins and high fixed costs related to staffing and space, and those costs do not go down if a child is not in the program for several days for any reason. Just so to summarize, the repeal of the 2024 rule will weaken the system and ultimately cost providers and families. And it'll have a damaging impact on, smaller childcare providers, both home-based and center-based. And so we're really hoping that this doesn't happen. And a lot of national organizations have decided to submit comments to the Department of Health and Human Services during this comment period that's open until February 5th. And I know NAFC has also made a template comment for those of you who wish to submit comments. You can use it and you can submit it. And I believe that's coming out or coming to you in a link in a follow-up email. So it's so important that you make your voice heard, and we would love to have you submit a comment. And with that, I will hand it back to Daphne.
Yes, thank you. Thank you both for sharing so much about the policy. So we've talked about the policy, and now we're going to switch to talk about what does it mean in real life, because we know that while everything that's been shared is a lot, we also know that it comes down to family child care educators who are absorbing that risk and experiencing the instability. So I'm grateful to have Cheryl Hudson Biller with me today. Cheryl is a family child care educator and small business owner in Montana, and she's seen firsthand how payment systems can shape program stability. And she's going to join me to respond to a few questions that we have to make this on the ground.
Hello, everyone. Thank you, Daphne. I'm excited to be here and to share my perspective from what I've heard from other childcare providers across the country, not only just those in my state.
Thank you, Cheryl. So we know from the 2024 rule, it was a huge win for provider stability. So what outcomes do you see for childcare programs if they are forced to go back to attendance-based payments? For those who have already switched to enrollment, we know that several have not moved to enrollment yet, but for those who already have moved to enrollment, what does it mean for them if they would have to go back to attendance-based payments?
So as we already know, our tuition rates and our reimbursement rates don't cover our true cost of care already. And if we were to go back to attendance base, that's just like if we were working if we started a new job and we became ill and we don't get sick pay, we don't get time off, we don't get paid time off. So this is what's going to happen is that educators, again, who we're starting to come up out of that hole, we are seeing being able to be paid by enrollment, we're able to have that leeway. We're not having to search out that second job. We're able to reduce our use of public services because a lot of educators qualify for SNAP, they qualify for Medicare or Medicaid. But when we're able to have in full-time payments for enrollment, we're able to breathe easier and we're able to relax around that. If we go back, we're going to see educators closing their doors because they're not going to be able to maintain. They'll go back to what it was before. And I feel that, yes, we took a big hit with what happened in December. We always talk about that, 2 steps forward, 1 step back. Well, I feel like we took 2 steps back. Because we are a profession that has to change our view or everyone else's perception of us, and this did not help.
Yes, and we know with the childcare supply already being so limited, we cannot afford to lose anyone, but especially family childcare educators who are filling some of those much needed gaps in communities. So the Department of Health and Human Services mentions reducing administrative burden as a goal for this rollback. From your perspective, does removing the 7% copay cap help family childcare educators, or does it add on to more barriers for the families that you all are serving?
So removing that cap is going to allow states to increase that threshold, right? Which will remove families from the workforce, which will remove children from childcare because they're going to have to make that decision. Well, my paycheck's going to go to my copay to cover childcare. So why should I do that, right? So I think that we will, again, we'll see children and families leaving childcare. I think that it's going to become more, it'll recreate a barrier for families again because they're not going to qualify for assistance where they really want to be able to better themselves, be participating in the economy, and that they're not going to be able to qualify for assistance, and they need that help up to be able to better themselves.
Yeah, definitely seeing the ripple effects that each one of
Mhm.
these decisions has on our entire community, not just on educators, not just on families, but entire communities. So the comment period for this new rule that we've been talking about tonight ends on February 4th. What do you believe is the single most important point an educator, and specifically a family child care educator, should include in their public comment to make their voice heard?
That we are professionals, and we should be valued for what the services that we offer to families. I have always said, and I've said this for a long time, that family child care providers, we not only care and educate the children, but we also support those families. In my program, myself, if my family is needing a resource and I don't know where that resource is, I know people to be able to find that resource. And I feel that we're able to uplift families and support the whole family, the family as a whole, which then feeds into the economy, and it feeds it, it makes them feel better, and it makes them be more productive members of society. I think that we need to really express that we are valued, and we're trustworthy. It's like many other professions. We should be treated the same way.
Yes, I agree. My 3-year-old daughter attends a family child care, and we could not do it without our family child care. So 100% agree that you all keep the world running in a lot of ways. So as an entrepreneur, you have fixed cost, you have rent, utilities, insurance, homeowners insurance. Those don't disappear when a child is sick or when a family goes on vacation. What consequences does attendance-based payments have on you running and operating your business, and for your home?
So in my case, I also have payroll, and many of us do have payroll. And it will be myself that takes that hit so that I can continue to pay my employees. And we have to have some place to operate our programs. We have to have some place to live. We have to have, we have to be able to feed our own families. And we always seem to be taking the back seat, and that's because we aren't viewed as that we are that we're of value, and that we are professionals, and we need to be able to represent ourselves that way, so that way people are understanding that this is a profession. After all, many of us have higher education, and if our degrees aren't showing that we're professional in what we are doing, then that should also fall back on other professions that require degrees also, right? So I think that it's just, the owner is the one that always takes the hit, and then it trickles down to the families, because then if I'm not able to pay my rent or my mortgage, then I have to close.
Yeah, yeah. Thank you for sharing those very real examples. So if you could bring a lawmaker into your program for just 1 hour, a day would be nice, but we'll just do an hour. What is one thing you would want them to see about your work that maybe they're not considering when they're looking at rolling back these 2024 rules?
I would like for them to sit and listen to the interactions that we are having with these children and having with these families, and the interactions these children are having with each other and back with us, and to understand that we're building the next leaders. We're building up the next leaders, and for them to see what they're doing and the conversations that we're having. Just as an example, I have a 4-year-old that can tell me all about space, and that's his favorite subject. And I had a staff member come in, and she's had to sit with him for about 20 minutes and talk about space because he was going to tell her how it was. We're giving these children these opportunities to think big and think about what they want to become. And that's what I would like them to see.
Thank you so much, Cheryl, for sharing your experiences and wisdom and reminding us of what is important. For everyone else, we have to remember that when policymakers are talking about flexibility or reducing burden, we have to ask ourselves as well as them, who are they reducing the burden for? Who are they reducing or making it more flexible for? And what is the cost to doing that? So thank you for giving us an example of who could potentially be taking on that burden and the cost that comes with that. So thank you. All right, so now we're going to take a few questions from the audience. If we can spotlight Kara and Ruth as well. I'm going to see if we can get some questions from the audience. And if you have questions, please put them in the Q&A or in the chat, and we will monitor that as well. Did anyone see any questions that they want to address openly while I'm looking through the...
I will. Someone said in Q&A that it felt like a slap in the face to providers, and I just wanted to echo that because I feel a lot of anger about what has gone on this month and how providers have been treated. And I encourage you to make your voice be heard right now. And I know it can be really tiring because you've probably felt like you've been having to make your voice be heard for since COVID hit. So it's been a lot of years of having to make your voice be heard. Um, but I think it is, and I will be honest with you, they're gonna repeal this rule. We're gonna make our voices be heard, and they are gonna repeal this rule. And I think it's important to be honest with you about that. But it is important that providers go on the record saying what repealing this rule will do to you, so that there is a record. Someone said in the chat that you're going to be losing a lot of home-based providers and families because of repealing this rule. Cheryl talked really wonderfully about like the real-term consequences of changing back to attendance-based. Someone talked about in the chat about how Vermont is going to give up on moving to enrollment-based. I really, really encourage you to continue to both send in your comments and let them know what this means, because it is really, really important that your voices get heard, because we will use it. We will use it as a field to continue to make our points about how important these policies are for providers and how necessary it is for the childcare sector. And also, it's important to know that when they repeal the rule, it doesn't mean that enrollment-based payment practices won't be allowed. They will be allowed, so states can still choose to do it, right? And so there's the having your voice with the feds, and it's important to put those public comments in, really, really important, because we will use that public record as a field, continue to fight for these policies, but also in your states. The fight continues on a state-by-state basis. It's always better when we can do it at the federal level and say all 50 states have to do it. But being able to fight within your state as a community and be able to tell them exactly the things you've said in this, that not continuing the progress of moving to enrollment based is a slap in the face to providers. Putting these ridiculous anti-fraud things is a slap in the face of providers who work in their butts off every single day to serve their community. Let your voices be heard.
I just wanted to piggyback off of what Ruth said about enrollment versus attendance. In Montana in 2023, we actually put that into law. We put enrollment versus we're paid by enrollment, and then we put a cap on copays at 8%. That is law in Montana. So, and I know that our state won't. I think that we would have all childcare providers at the Capitol if that tried to come down. I really, really do. So, and I know that Montana is moving forward with their plans with the Biden rules. So, we're very fortunate about that. But that's something to think about within your own states, is to get that into law.
I can uplift a question if it's helpful.
Thank you.
In the chat, we have Teresita Moreno asking, I'll say it in Spanish because that's how she wrote it. ¿Qué significa pagar por asistencia y inscripción? So what does it mean to pay for enrollment versus attendance?
So I can answer that. So our subsidy is paid out at 22 days a month. So I get paid 22 days for that child. That's an authorized amount for 22 days. If that a child attends my program 1 day a month, I'm getting paid the full authorization amount. My private pay families already pay for that slot. They don't pay by attendance. They pay me for the whole entire month. So now Montana's subsidy is doing the same thing. Did that answer that question?
Yes. Thank you. From anonymous attendee, good evening. It was mentioned that tomorrow is the hearing for the temporary block against the funding freeze. Where can we tune in to stay updated?
That is a good question. I don't know if that is, I don't know. But it will be in the papers for sure. I expect that to be heavily covered in the newspaper, whatever comes out of that. And Daphne, I don't know if when you guys do your updates, but whatever comes from that hearing will certainly be big news. To be clear, what may happen is they just may continue blocking the freeze while the lawsuit continues, because lawsuits take a while. But the next day they are in court is tomorrow.
Thank you. And do we have time for another question or a couple questions?
I think we do.
This question is from Delan Singh. When is this supposed to trickle down to other states, and how will this impact new early start contracts? And does it affect the yearly surplus funding for childcare?
So there are a few different questions there. A couple of them I'm probably going to need clarification on. As to if this will go to other states, the short answer is we don't know, right? So this was not based on any actual fraud. So we can't look at what might be going on. We don't know what they may do next. They have made other threats against other states. It certainly could be that they do something similar with other states. This administration is unpredictable, and unfortunately, they have a history of freezing funds. This is not the first time they have frozen funds and have been sued about it. It's just the first time they've frozen childcare funds and been sued about it. So it is hard for anyone, I think, to feel really comfortable knowing what comes next or anticipating what comes next. Same thing with the defend the spend piece of it. Even though those states don't have their funds fully frozen, because we don't know if they are being equal in how they are reviewing all of the states. We don't know if they are being fair across states. So it is something that we are continuing to watch carefully. I will say some of the big law firms like ACLU is looking carefully at the defend the spend piece as well as the 5-state piece to see if there are lawsuits that need to be filed as well. But it is all evolving right now. The Trump administration has not announced any additional plans for any additional states yet. The other two pieces of the question sound specific to the state you're in. Something about surplus funds.
Ruth, there were a few questions that we have, but for state-related questions, is there one place that individuals could go to get information about how their state is implementing, or how they're responding to this? Is there one place that they can
How they're responding to what piece of it? I'm sorry.
to
The
defend the
new rule
spend, or I'm sorry,
I would say the rule,
or the rule?
and you had provided a link
So I
to,
put a link in the chat. It's a little bit out of date because it's something we published while I was still at the Office of Child Care on where states were at implementing the 2024 rule. So if you were not quite sure if your state did enrollment-based payments or any grants or contracts or 7% cap or prospective payments, I put a link in the chat. It's some states have done it since we created that fact sheet. So South Carolina and Maine are the two I know that did, but I think there's one that I'm not remembering. We don't know um, about other states and their plans yet. It's a little too early. I think you all may have a better idea of what you're heard. Someone put in the chat that they've heard that Vermont is planning on abandoning their plans to move to enrollment based. I mean, it costs states more to do enrollment based than attendance based, right? Because attendance based is cheaper for them because you all take on the extra cost. That's why we wanted enrollment based, because the state takes on the cost that they should be, not you all. And so it costs states more because they're taking on the cost that they should instead of you all. Um, and so I think, I think for many states, if they are not required to do it, um, uh, you know, many of them will not do it, and some of them will do it perhaps quite a bit slower than they had intended. But I think it's still a wait and see, and we will be relying actually on the provider and the community and the child community in each state to give us updates on what is happening in states and how they're pulling back.
Thank you so much. And thank you all so much for your questions. For those that we did not have a chance to get to tonight, we'll respond to those and send you out responses when we send out a follow-up email. So please be on the lookout for those responses. And I think that's a great segue into what do we do? What do we do now? And so we have some information for you all. We appreciate the insight that we have tonight, and we know that it doesn't end here. Now it goes to you all, it goes to your voice, and it goes to how you all fit into this moment. We all, as early childhood advocates, as Ruth mentioned, need to keep a record, and we need to show up when policy change demands us to. The administration needs to hear directly from those who are on the ground and facing impacts from these policy changes, like you, family childcare educators, as small business owners, not in broad theory, but in the day-to-day reality of what you're experiencing. And one way to do that, as Kara mentioned, is through the public comment period. We will be sending you out a template that you all can use. Everyone will be receiving a link to a template that we created specifically for family childcare educators. And it's just a template to help you get started. If you've never written a public comment before, this is just a template to help get you started. But it's really to help you focus on adding your own experiences. So we encourage you to use I statements and once again, tell your day-to-day reality. There are lots of other ways to take action too. At NAFCC, we support state and federal level advocacy efforts as well as narrative work. So telling your stories and telling what's happening on the ground is so critical to policy change. So one way that you can do that is to sign up or visit our policy webpage for updates to stay informed. We share regular updates on legislation, regulatory changes, funding shifts, as well as opportunities to speak up and share your story. So if you're not already on there, if you're not already checking it, we encourage you to do that. Another way is to tell your story. And we have a link where you can tell your story to us, and we will compile those and help get those into the hands of people who are making decisions about policies that impact your day to day. We believe that policymakers listen differently, and seen this firsthand. Policymakers listen differently when they hear stories about real programs, real families, real business owners. And stories about how all of these policies that we've talked about tonight impact you are so critical to be sharing right now. We also encourage you to connect with policymakers and other advocates when you can. We try to organize meetings and conversations at the federal level, as well as at the state level. But so much work is happening at the local and state levels, just like Ruth was just saying. The fight is really at the local and state level now. That's where childcare is really winning in states like New York and New Mexico. We're really seeing childcare policy win. And so we have an opportunity to kind of capitalize on the local and state conversation right now. So we have an action toolkit that we're going to put in the chat right now, and there are that was from the rapid response that we did when we first heard about these funding freezes. So in the action toolkit, you'll see a link to the press release that NAFCC did, and you can share that with partners, or you can use it as a template to create your own. We also have in there resources to take action. So you'll find pathways on how to email your members of Congress, call your members of Congress, and share your stories. And then there's also talking points that have been tailored for family childcare educators on how to talk to media, policymakers, and partners about the current situation that we're facing. We're continuing to update and expand that toolkit, so be on the lookout for changes as well. So we know that in all of this, family child care is not a footnote in the system. It is the system for millions of working families like mine that makes it work. And public comments and getting involved in stories and action are how we make all of that visible, and it's how we continue to defend it. So thank you all for taking the time to be here tonight, for being engaged, and doing the work that you do every day that makes everything else possible. And I'm going to turn it back to Erica now to close us out.
Thank you. Thank you, Daphne. This is Daphne's first policy webinar, and we are so proud and thankful for her. So thank you so much. I want to thank everybody who attended tonight. Thank you for your time, your attention, for staying engaged after a long day and in a moment that I know can feel very heavy and uncertain all around. Thank you to Ruth, Kira, and Cheryl for sharing your expertise. I learned some new things today. I was furiously taking notes, and I saw a lot of comments in the chat where we were able to break down and hear things about these really complex policy conversations, but we know they impact family child care. And at NAFCC, our commitment is to making sure family child care is not an afterthought in these conversations. We know you're essential. You know you're essential. Your families know you're essential, and that you're going to do whatever you can do to be there for your children and families. And please know we are going to do whatever we can do in our power for you. So we encourage you to stay informed and to take action. Check your email, follow those links that Daphne was sharing and they're put in the chat. To raise your voice, even if it doesn't feel like people are hearing right away. The more of us who speak up, who share what's happening and how it impacts us and our families, we will see a difference. And so earlier this week, we celebrated the birthday of Dr. Martin Luther King Jr. And so in light of this, I want to close with some of his words. And he said, I believe that unarmed truth and unconditional love will have the final word in our reality. So let's continue to move forward in truth and love. Have a good evening.